In the world of healthcare, trust between patient and doctor is essential. Patients look to their doctors not only for medical competence, but also for understanding, compassion, and most importantly, attention to detail. However, in some cases, medical practitioners may fail to recognize or ignore signs and symptoms, potentially leading to catastrophic repercussions for the patient. The same happened in this story we're about to share with you. Stick till the end to know more and figure out what you should be doing if you find yourself in the same situation. Jason Randall is a 40-year-old digital cartographer and Navy veteran from Eudora, Kansas, whose journey began in 2005 when he started having stomach issues and was diagnosed with gastroesophageal reflux, most commonly known as GERD. However, his initial symptoms were completely ignored by his doctors, which made the patient deal with severe consequences much later in 2018, when he started developing severe abdominal pain and infrequent bowel movements. Later on, what was found in a scan was nothing but something devastating for him, which really made him think to take the whole situation a bit more seriously. However, this was just the beginning. Initially, when this started back in 2005, and Jason was experiencing intense pains in his abdomen and was diagnosed with stomach distress, the doctors gave him acid-reducing medications including Prilosec and Zantac. He'd taken them for years, and apparently, they appeared to work. Sometimes, some patients go into misery in the very initial stages of the disease. However, in Randall's case, everything seemed fine until 2018. He was 35 years old, married, with 2 children and a baby on the way. He suddenly experienced 2 weeks of serious distress, including cramping and the inability to move his bowels. A series of scans revealed that he had stage 4 disease, which included a big tumor where the rectum and colon meet, as well as malignant tumors covering 80% of his liver. Later on, it was found out that Randall had stage 4 colorectal or colon cancer. The news, along with the dim outlook, hit hard, and Randall felt caught off guard. According to him, it was totally shocking to him, and at some point, he started wondering if all of this was a bad dream and that it will end soon. Jason also recalled how he thought of the whole situation as nothing but a nightmare. He said that once he received the news, he started crying, and when he called his wife, she did nothing but started crying as well. Amidst this difficult situation, Randall was also worried about his children. At one point, he mentioned that he was so worried about the whole thing that he asked himself if he is going to live long enough to see his 3rd child who wasn't born yet. Will he be able to see his 2-year-old grow up? He was also worried about the fact that if he dies, then his wife will be left alone to raise 3 children. And one of the most dreadful thoughts that he was having at the time was, will he be able to live long enough to see his daughter's wedding? Which is nothing more than a dream for a father. All of these gathered up in Randall's mind, and he became pretty stressed about the whole situation. Randall needed hope, even a glimmer, but his Kansas medical professionals offered none. They offered treatment, but deemed his tumors inoperable. They stated he'd be on chemo for the rest of his life, but they didn't tell how long or how short. In August 2018, he began chemotherapy with a kitchen sink regimen known as FOLFIRINOX, which stands for a potent multi-drug combination of leucovorin calcium, fluorouracil, irinotectin hydrochloride, and oxaliplatin. Apart from that, Randall also got Y90 treatments, which involved injecting radioactive pellets directly into his liver. By October 2018, Randall's tumors had decreased by more than 40% and were still shrinking. He reasoned that he could have surgery to eliminate the residual malignancy at this point, but the tumor board said no. This was something Randall didn't expect to hear. At this point, all of it did not make any sense to him, and he decided to delve deeper, with a little help from his online friends. Randall discovered Colontown, a Facebook network with over 130 private groups for colorectal cancer patients and caregivers. Randall sought a second opinion and received one promptly. According to him, this literally saved his life. Yuman Fong, MD, was not astonished that a Kansas resident had heard of him or that a Yuman Fong fan club existed on a social networking platform. So this was a big moment for Jason Randall. According to Yuman Fong, almost 80% of his patients reside outside California, and Jason Randall was one of them. Randall and his wife Talina opted to fly from Kansas to the City of Hope's Duarte campus in late 2019 in the hopes of receiving a better diagnosis. But what did Fong see that the other doctors didn't? Well, it was the amount of cases that he'd been dealing with for quite some time. With more than 30 years of expertise in the operating room, Fong has witnessed and contributed to significant advancements. Surgical procedures have significantly advanced. Drug therapy is far more effective at shrinking cancers. Most importantly, liver cancer is no longer synonymous with inoperable. This was the moment Randall had been waiting for so long. Randall's operation was carried out in February 2020. It took 12 hours and needed 2 surgeons. Fong resected the entire right side of Randall's liver and any lingering lesions on the left. His colleague, Andreas M. Kaiser, MD, professor and chief of the Division of Colorectal Surgery, Department of Surgery, got rid of the rectosigmoid tumor, a section of the colon and a piece of the rectum, and created a temporary ileostomy to allow the colon to heal by inserting the end of the small intestine through the abdomen and collecting waste into an external bag. It went pretty well for Randall, but not without some difficulties. Back home in Kansas, cancer developed in his lung, necessitating an ablation procedure. It also affected his tailbone, which underwent treatment first with pelvic radiotherapy and then with an abdominal perineal resection, which involves removing the anus, rectum, tailbone, and a portion of the sacrum. Though his temporary ileostomy had been retracted, Randall now required a permanent colostomy through his belly because his typical route for waste elimination no longer existed. So what about the present moment? Randall handled everything, particularly the colostomy, like the resilient, positive, professional Navy person he is. In fact, he now welcomes the prevalent external pouch because it allows him to dedicate only a few minutes per day to physical demands, as opposed to the hours he used to spend in the bathroom. It does not interfere with his lifestyle. He swims almost every day, and his weight, which had dropped by more than 100 pounds during his experience, has now returned to normal. After 2.5 years without chemotherapy, he was classified NED for 16 months, indicating no evidence of the disease. He is giving back by acting as a Colontown cabinet member and donating his digital talents to Man Up to Cancer, an organization that helps men with cancer support one another. And while the marks from his battle may endure, they also serve as a reminder of the courage that each of us possesses, waiting to be unleashed in the face of adversity. Let us know in the comments what your thoughts are on this. If you enjoyed watching this video, then don't forget to like and subscribe to the channel and ring the notification bell icon to always stay updated with more of such interesting content. Thanks for watching.